Chugging a pitcher of water, listening to the rush of a waterfall. The jingle, gotta go, gotta go, gotta go right now. These are external stimuli that might make you want to cross your legs or speed off to the restroom. For patients struggling with urge incontinence, they experience a strong, sudden need to urinate for no discernible reason.
It's basically that their bladder is not necessarily full, but it's telling them that they have to urinate. And the wait time, basically the time it takes for them to get the urge to the time that they can make it to the bathroom, is significantly decreased. So people with urge incontinence, when they get the urge, may only have from 1 minute to 5 minutes to make it to the bathroom.
The urge is caused by abnormal bladder contractions. Normally, our bladder only contracts when the bladder is full. There are strong muscles called sphincters that close off the door between the bladder and the urethra, the tube through which the urine exits the body. When someone has urge incontinence, the muscles of the bladder contract and override the closed sphincter muscles, resulting in leakage. In many cases, we don't know why these abnormal bladder contractions start. Diseases like diabetes, stroke, or injury can cause nerve damage. Pelvic surgery, prostate conditions, obesity, age, certain cancers, and urinary tract infections might also cause urge incontinence. The key to treatment is determining the underlying cause.
I do a full history and physical. I will ask more about neurologic issues and history of diabetes, because these two can lead to urge incontinence. A trial of an anticholinergic, which is a medication that quiets the bladder, can be made if the person seems to have overactive bladder. If the symptoms are unsure or the trial of anticholinergics does not work, then I will proceed to a urodynamics test, similar to what we do for stress incontinence. And basically, the urodynamics test is to see exactly what your bladder is doing when your bladder fills, because this is a time that you have the symptoms of overactive bladder.
Urge incontinence treatment options can vary. Pelvic floor physical therapy helps strengthen and control the pelvic floor muscles. Behavioral modification might help you manage or anticipate the urge. These modifications can include avoiding fluids right before bedtime, avoiding drinking diuretics like caffeine or alcohol, and going to the bathroom on a regular basis.
So there are several foods that irritate the bladder, and these can be spicy foods, caffeine, tea, and what I found is even green tea pills can also irritate the bladder. And these things can make you want to go to the bathroom more often. So oftentimes when a woman has urge incontinence, I encourage them to stay away from these foods. Also, when a woman has urge urinary incontinence and they find that they're urinating only small volumes, I also encourage them to try what we call bladder training, which is try to hold your urine as long as possible before going to the bathroom so that you have larger volumes of urine in your bladder. In doing this, you will allow more time in between urinations. I don't encourage this for women who don't have urge incontinence, but this has improved symptoms in women who do have urge incontinence.
When behavioral modifications and physical therapy don't completely control the incontinence, medications and surgical treatments can provide relief.
Medications such as anticholinergics and a new medication group called beta-3 agonists basically help quiet down the bladder to give a person about 30 more minutes to make it to the bathroom. Botox, which is similar to the medication that people use on their face for wrinkles. And basically what that does is it numbs the bladder muscles so that they don't contract as frequently. Another treatment that we sometimes do is what we call percutaneous tibial nerve stimulation. And basically, in layman's terms, that's an acupuncture-like procedure where we stimulate the tibial nerve, which sends messages to the bladder. And after about 12 weeks of treatment, you have a significant improvement of your urgency and urge incontinence. The last is a special test, which tests the sacral nerve, which also can send messages to the bladder to help quiet it down. If this special test turns out to have significant results, we can make that test permanent.
Urge incontinence can have a significant effect on lifestyle, and it's more likely to require treatment than either stress or mixed incontinence. There's no amount of leaking that is too little to discuss. If you're having difficulties and it bothers you, talk to your doctor about treatment. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.